And thank you, Kibben. Well, the month of February is American Heart Month, and when it comes to discussions about one's heart, common medical problems are heart disease, high blood pressure, or even heart failure. But have you ever heard of congenital heart defects? Well, sharing more with us here in studio is Dr. Nicole J. Sutton, Pediatric Cardiologist of Montefiore Medical Center. Dr. Sutton, good to have you.
Thank you. Thank you so much for inviting me to be here.
Good. So talk to us about this, Al. We talked about congenital heart defects. What exactly is a congenital heart defect?
So a congenital heart defect is something that is with the structure of the heart that someone is born with. So it forms actually when the babies are growing inside of their mother and is something that stays with them their whole life.
So give us a little bit about specialty care. How do you guys deal with, babies and those who have congenital heart defects?
So we actually take care of patients from the time they're fetuses. We actually have a program, a whole fetal heart program, where we see women with who are pregnant, who people suspect have heart disease, and we can actually do special ultrasounds to diagnose babies with heart disease, so parents and OBs can plan for those babies' deliveries, and we can make plans for when or if they might need surgery. We see them from the time they're born until they are adults. We actually will see people on the same day who are 3 weeks old and 58 years old. We have a whole subspecialty of cardiology that's called for adults with congenital heart disease. And we have a big program for that. It's the Montefiore Adult Congenital Heart Program to follow those adults as they get older, because we have such a spectrum of disease that we see.
When somebody says disease, obviously there's a connotation right off the bat, right? It's really rough, it's really tough, it's really scary. So when you talk about somebody with congenital heart disease, walk us through the process of how long does this disease last? Is it lifelong? Is it something we can grow out of? Is it something that you grow with? How does it go?
So when we talk about congenital heart disease, there's a very large spectrum. There are very minor problems, and then there are major problems that result in lots of surgeries and might even wind up with a heart transplant. For every patient, it's very different, and often the way they get to us, it can be very harrowing for families. People get very concerned when heart disease gets brought to them, especially families with newborn babies, or when you're pregnant. You don't want to hear that something's wrong with your baby. You want to hear that everything's perfect. And so we try to address the individual problem of that patient, and that's why it's a very variable thing what we do. Some patients will have a problem that can be fixed with one procedure, like a surgery, or even what I do, which is catheterization. We can close holes that way. We can sometimes avoid surgery completely in some patients. Most patients who have some congenital heart disease will need to be followed, though, for their whole life by a cardiologist. And one of the things we try to do is help people learn what their heart looks like and what they should do for that. Most of our patients, though, no matter what their lesions are, go on to lead full lives. They go to school, they play sports. We actually have patients, one of our patients has very bad, on the very severe spectrum of heart disease, and is a competitive gymnast. So there's no thing that we say you cannot do.
Right.
It depends a lot on how you feel. And we actually feel it's very important to be able to do normal kid things. Go to school, play sports, go to all your regular things that kids like to do. And then as you get older, go to college, get a job, get married and have kids. And so we do all of that counseling with our families from the beginning.
Well, what advice do you have for parents? Because obviously for a parent, it is a harrowing experience.
Right.
You're looking for this healthy child, and then you're faced with this challenge. So what advice do you have for parents if they're suffering?
So if there's a question about congenital heart disease, one of the good things to do is to go see a congenital heart disease specialist. And that's usually a pediatric cardiologist. And if you have a baby, if you're pregnant, then you would start by seeing one of the fetal specialists. Those are people who do the fetal ultrasounds on the belly, take good pictures, and will give you a lot of information. We're very open to discussing everything and talking with multiple doctors. We do everything in a team. So we have a team of cardiologists and surgeons who will meet with families. We have social workers, we have child life specialists, everything to help. We make sure, and we try to make sure that people understand what's going on and that we tailor the care for their life and for their lifestyle. So if some families, the first thing they ask when they hear about this is, will my child play football? And other families go, will my child be able to go to college? Right? Everyone has different goals and ideas about what they want to do, and we want to help them get there. And for most of our patients, they can do that. They can do normal things and be normal kids. And we try to make people understand that while there's a problem, it doesn't have to be the whole definition or limitation of their life. And the thing that we really like for people to do is to do things that are healthy for them. Exercise, play sports, eat healthy, and do all those things that kids like to do.
So give us this before we go. This month obviously is a very busy month. Activities, things going on?
Yeah, so at Montefiore, there's a whole series of events happening this month. There are events that are open to the public to learn about how to take care of your heart, how to eat healthy. You can get screened for hypertension. And in pediatrics, we actually have a pediatric heart party, and we celebrate for all the kids who we see. We have a big party right around Valentine's Day to celebrate their special hearts.
Red is for Heart Month, by the way.
Yes, it is.
So we all got the red on. Listen, before we go, we talked a little bit off camera just quickly. Talk about numbers, because you're talking about how the numbers, how numbers have changed.
Oh, sure. So congenital heart disease is actually the most common congenital defect. It happens in about 1 in 1,000 babies. And as I said, it's a big spectrum from mild problems to big problems. But what's happened over the last 20 years is that all of our surgeries have gotten much better. And so people are surviving, which is great, and they're becoming adults. What that now means is that there are more adults with congenital heart disease than there are children with congenital heart disease. And that is where the growing number of patients are, and why we focus a lot on these adults with congenital heart disease. They do need to see specialists in adult congenital heart disease because they're in their 20s and 30s and they don't have coronary artery disease. Right. They have different set of problems.
So that causes a new set of things they have to do.
Exactly. So they have to do slightly different follow-up and different things than an older person who might have hypertension or coronary artery disease.
Well, Dr. Nicole Sutton is the pediatric cardiologist at Montefiore, and thank you so much for sharing with us.
Thank you so much for having me.
All righty, listen, we're going to take a quick break. Got more show. Remember, Red is for Heart Month, so don't go anywhere. Come right back right after this.